This item of business is a statement by Jean Freeman on care homes. The Cabinet Secretary will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on the Cabinet Secretary. Jean Freeman, please. Thank you.
Thank you very much, Presiding Officer. I want to touch on a number of issues with respect to care homes and say a bit more on the commitment that the First Minister has outlined with respect to Programme for Government. We have discussed and debated the situation in our care homes over the months of the COVID pandemic many times, and rightly so. From the outset of the COVID-19 update statements to Parliament from the First Minister and from me, we set out the plan we were putting in place to prepare our NHS in the face of the evidence at that time of significant hospitalisation and intensive care demand. We set out our intention, amongst other work underway and at pace, to ask health and social care partnerships to focus on reducing the level of delayed discharge, a long ambition of this and previous governments. Over the weeks and months since then, we have updated the initial guidance to care homes, strengthened the primary care support and increased testing. But there have been many deaths in our care homes, and it is right that we and this Parliament use accurate data and analysis to look at the decisions taken and the actions that followed, to see, with the increased knowledge we have now, what more could be done, not only for the rightful purpose of scrutiny, but critically to aid our planning for the weeks and months ahead. The loss of a loved one is a weight that stays with any one of us for the rest of our lives. It is a loss that is made heavier if we've not been able to be beside our loved one in the final hours. And one of the deep cruelties of COVID-19 is that at a time when we would look to friends and family to help shoulder the weight of grief, we've been forced to stay apart. The weight of the loss of so many of our fellow citizens to this brutal virus will never leave me, and I know many others. As I set out last month, I have commissioned Public Health Scotland to report on discharges from hospital to care homes and what the COVID-19 status was for those who were discharged at the time of their discharge. This should also include information on the outcomes experienced by those patients, and this work should be ready to be published by the end of this month. As I set out in this Parliament in March and April, we gave a clear goal of reducing delayed discharges, and as we have considered many times, the guidance made clear that any such discharges should continue to be subject to clinical risk assessment. The UK Coronavirus Act 2020 allows local authorities to undertake partial needs assessments by dispensing with particular social care assessment duties, but only where it would not be practical to do so or where to do so would cause unnecessary delay in providing community care services to any person. The powers are designed to allow local authorities to provide urgent care without delay, protecting the lives of those who are most vulnerable, whilst also ensuring safeguards are in place. I gave evidence to the Health and Sport Committee on the legislative consent motion on the 24th of March, and the regulations came into force on the 5th of April. These powers have not been widely used in Scotland. In the monitoring periods to the 2nd of July, 7 out of 32 local authorities have used the powers in the specific type of circumstances I have described. In recent days, we've seen reports of delays in the care home testing carried out through the UK Government's testing portal. There have been issues, as members of the Chamber are aware, with the UK's 3 Lighthouse Lab network, and we are in daily contact with the Department of Health and Social Care to address these and ensure we can continue to access the capacity we need, at the same time as we continue the work to bring more NHS Scotland processing capacity on stream to increase resilience and mitigate any issues with the UK's portal. These recent challenges have seen some test results delayed, but having looked in detail, I'm pleased to advise the Chamber that these delays have not been as extensive as recent reporting suggests. Even so, delay beyond 48 hours must be minimised, and we are working with our UK colleagues to improve this even more. I well understand the upset and dismay caused to both residents and families of the restrictions on visiting, and I hope that the steps taken since early July to return visiting in a phased way, both indoors and outdoors, have been helpful. We are now finalising guidance for care homes to support the return of in-reach health and care services and the safe reopening of communal areas. Caveats apply here, as you would expect, in terms of the care home being free of COVID-19 and fully participating in the testing programme, but with that proviso and the necessary health and safety measures in place, these activities should be able to return, and I hope to publish the relevant guidance shortly. It will, however, remain the case, as we have seen in Aberdeen and in Tayside, that where we have a higher prevalence of the virus in an area, that may necessitate the restriction of care home visiting in order to protect residents whilst an outbreak is brought under control. Presiding Officer, the pandemic has seen a pace of change in the delivery of many aspects of our healthcare service that was previously unimaginable. It is a pace of change that is necessary for our adult care sector. As the First Minister has set out in our programme for government, I have commissioned an independent review to examine how adult social care can be most effectively reformed to deliver a national approach to care and support services. I've made no secret of my sympathy for a national care service, and this will be part of the considerations of the review. The scope of this review will include how adult social care is organised, commissioned, regulated and funded. I'm pleased to inform the Chamber that Derek Feely has accepted my invitation to chair the independent review. Many will know Derek from his time as our Director General for Health and Social Care and Chief Executive of NHS Scotland. He will be ably supported by an advisory panel drawing on expertise from Scotland and beyond. That panel is Caroline Gardner, who was until very recently Scotland's Auditor General, Malcolm Chisholm, a former Minister for Health and Community Care and a former member of this Parliament, Anna Dixon, the Chief Executive at the Centre for Better Ageing, Johan Henriks, Chief Executive of Learning and Innovation from Jönköping County in Sweden, Councillor Stuart Curry of East Lothian Council and COSLA, and Ian Welsh, Chief Executive of the Health and Social Care Alliance Scotland, and also a former member of this Parliament. Their task is not an easy one, and I'm very grateful to each of them for agreeing to be involved in and to lead this work. The review will build upon the reform of adult social care that was underway in conjunction with COSLA before the pandemic and had at its core the views of those receiving social care, and has been examined before by the Health and Sport Committee at that time. I believe that across this chamber we have a shared view that we need both to improve outcomes for people who use these services and also ensure a good working environment for a key workforce whose criticality has been emphasised in recent months. I have agreed with the independent chair that the review will take a human rights-based approach with a strong emphasis placed on the needs, rights and preferences of those who use the services, their carers and families. Social care services and supports are enormously varied, covering everything from care homes and care at home to day services, befriending and supported employment. These services touch the lives of a very wide range of people: disabled people, older people, people with mental health problems, people with drug and alcohol problems. We must consider the needs of all of them, equitably, fairly and respectfully. People using services and supports should be consistently and routinely informing the process of improvement and be involved in co-designing services. Derek Feely and his colleagues are ready to begin immediately and will report in January 2021. This is a very tight timescale, but it will ensure that the next Parliament has the options before them straight away so they can take any steps necessary, legislative or otherwise, to put in place the reforms our adult care sector needs. I know that the care many people receive is already good, and that people who work in care in Scotland are beginning to feel more valued and certainly more recognised for the work that they do. But not enough yet. I'm determined that we go further so that positive experiences are the norm, happening consistently by design and with intent. My hope is that the outcome of the review will give us a blueprint for the future that can secure consensus across this chamber. Presiding Officer, our adult social care sector is a vital service for very many people, helping them live as independently as they want and as well as they can. Those who work there are every bit as caring, compassionate and dedicated as those who work in our NHS. The experience of the pandemic shows us that very clearly, but it has also shone a light on the pressing work we need to do to improve those services and the support for those who need them and those who work in them. The independent review will offer us real solutions and, I suspect, difficult choices, but its work is vital. But right now, as the review begins its work, there is more for us to do, learning and applying the lessons so far from the pandemic in our mobilisation plans, in support for the sector and in cooperative working and fast responses to the problems and issues that arise. This chamber has my commitment that we will continue to do just that. Thank you.
Thank you very much, Cabinet Secretary. The Cabinet Secretary will now take questions on the issues under a statement. I tend to allow to around 5 to 5 for questions, after which we move on to the next item of business. So it would be helpful if members who wish to ask a question press the request to speak once now. My usual plea for succinct questions and succinct answers. I call Donald Cameron, be followed by Monica Lennon. Mr Cameron, please.
Thank you, Deputy Presiding Officer. I'd like to thank the Cabinet Secretary for advance sight of her statement. Can I firstly acknowledge the announcement about a national care service? We await further details on this and will comment further when concrete proposals come forward. Thanks to various newspaper investigations, we now know even more about the decision to send patients who tested positive for COVID-19 into our care homes. We have already found out that as many as 37 patients who tested positive were transferred to care homes and that this was sanctioned by clinicians, with several health boards still to report. And just this weekend, it was reported that at least one care home provider took in a person who the local health board said tested negative for COVID, when in fact the opposite was true. The First Minister has been asked repeatedly when she first learned that COVID-19 positive patients were transferred into our care homes, and she has repeatedly refused to answer. So let me ask the Cabinet Secretary directly, when did she first find out that this was happening?
Cabinet Secretary.
So I'm grateful to Mr Cameron for his question and his comments. In terms of the independent review, I do intend, once the review has developed its own work plan, including how it will hear evidence and information, and particularly hear from those involved in the sector, to make sure that colleagues across the chamber are aware of that and of the timescale involved. In terms of Mr Cameron's question, he'll know, as we've said more than once, that I have commissioned Public Health Scotland to undertake a piece of work which will look at all discharges and whether or not the individuals were COVID positive at that point, and at what point had they tested for COVID, so that we know whether or not they were infectious at the point of discharge. As we worked through the work in terms of care homes, we became concerned that we may be seeing some individuals, because of the fact that you can become COVID even after you have tested negative, that some individuals may be in that situation. And we became increasingly concerned about the numbers of cases in care homes. And that was when we not only updated the guidance on more than one occasion. Testing, of course, is one of the elements that you introduce in order to prevent infection spreading, but one of the critical elements is isolation and proper infection prevention and control in the situation. That was in the guidance from the 13th of March onwards. But as we understood more about the virus and how the virus transmitted itself, including in those who may be asymptomatic, and in the fact that in some elderly people in particular, there are different symptoms which can indicate COVID from the ones that are normally present in the rest of the population. As we understood more and more of that, then we understood that there may be a risk that individuals were going into care homes who had not been tested and needed to be tested, and it was at that point, I don't have the exact date in front of me, it will be in these papers, when we introduced testing as a requirement before admission to care homes. But the critical elements that were always there from the outset about isolation, infection prevention and control nursing, the clinical decision that the patient was ready for discharge, and the clinical risk assessment about where the person should go have been there from the very beginning.
Monica Lennon, followed by Alison Johnson.
Thank you, Presiding Officer. Care homes have been at the epicentre of this crisis, and it didn't need to be that way. On too many issues, the Cabinet Secretary and the Government failed to listen to frontline staff and families of residents on PPE, on testing, and what happened when people were discharged from our hospitals to care homes. The Government were too slow to act. Of course, we welcome a commitment today towards a national care service, and I look forward to getting around the table with the Cabinet Secretary and opposition parties. But Cabinet Secretary, the advisory panel doesn't include anyone from the front line, so we need to get that sorted. There's no trade union representation, there's no one representing the voice of workers, so that needs to change, because if we'd listened to workers at the start, we wouldn't have seen the tragedies that we've seen today. And on visiting, it's really important, Presiding Officer, that residents and their families don't pay the price for this government's mistakes and paralysis now, the fear to reunite those families. So I really need to hear a commitment as to when families can be reunited. There's too many people having to sit with elderly loved ones in car parks in wet conditions, and in some cases I've seen older people having to sit in underground car parks that are covered in pigeon mess. It's not safe, it's not hygienic, and it's a betrayal of people's human rights. And finally, because we have lost a lot of trust and confidence, the public certainly have, so we do need to have an independent, judge-led public inquiry. Will the Cabinet Secretary give an indication as to when she foresees that happening? We all wish her well in her retirement, but the public need to know that people who've made key decisions will be around for that public inquiry.
Cabinet Secretary.
So I thank Ms Lennon for a number of questions there, which I will try to answer. Can I thank her also for her good wishes? And just for the record, say I'm no away yet. And I have a lot of work still to do and a lot of energy to give to it. I don't accept that we have failed to listen. I talk to trade unions regularly. We talk with Scottish Care regularly. And actually, it was thanks to some of the discussions, in particular with Unison, that we managed, having introduced support for PPE to the social care sector, an issue raised first by Scottish Care, where they advised me that their private supply lines for PPE were not working as well as they needed them to be, that we introduced the direct support to social care, including care homes, of supplies of PPE, but it was the unions that were raising issues around the quality of some of the PPE, and it was thanks to that that we could address that and also reach agreement with COSLA and all the unions involved on the 2nd of April about exactly the right of care home workers to determine themselves whether or not, for example, they believed it was professionally important that they wear a mask or not. So I don't accept that we have not listened to staff. We continue to listen. I continue to meet with them and discuss that with them. And in fact, the trade union voice is involved in the recovery group on mobilisation that I chair. The advisory panel will undoubtedly reach out and hear from all the unions involved. First Minister, you already heard her say that she fully expected the advisory panel to want to hear from every opposition party in this chamber and others, as well as those who are families, relatives and so on. In terms of visiting, indoor visiting is already possible. Now, I accept, and I do genuinely, personally understand the difficulties here. But it is our clinical and professional advisory group that is advising me about what is the right steps to take in order to, step by step, stage a return to more normal living for people in our care homes. I know that is their home, But I also know that we need to protect them, and we need to have time in between each step to make sure that we have not caused unnecessary harm in those situations. So I hope, we now have more outdoor visiting. We need to change that as the weather changes, to increase indoor visiting, and very importantly, communal activity and a return of in-reach care and health services. And that is what I hope to be able to announce very shortly. And in terms of a public inquiry, we have had this discussion before. The First Minister has been clear that we do believe a public inquiry on the entire handling of this pandemic is the right thing, and that level of scrutiny is important. At the point when we think it is right for that to begin, we will come back to this chamber with the details and the arrangements for that. But one of the things I'm going to do at 5 o'clock tonight is a resilience meeting to discuss that increased number of cases that the First Minister announced. The pandemic is still here, and all the focus and energy has to be as much on that as on anything else right now.
Alison Johnson, followed by Alec Cole-Hamilton.
Thank you. I would warmly welcome the commencement of that public inquiry as soon as possible, and have previously raised concerns that congratulating health and care partnerships for achieving a target for delayed discharge at this particular time may create a culture where targets inadvertently affect actions and outcomes. I welcome the announcement of the independent review and the commitment to consider establishing a national care service, and the Greens wholeheartedly support that. But there have been significant outbreaks in our care homes during the pandemic, and the shocking numbers of death reveal the toll this has taken. But we don't yet understand the long-term effects. We may have large numbers of residents who require more complex care as a result of COVID infection. So can the Cabinet Secretary advise what steps are being taken to prepare for a potential upsurge in people experiencing more chronic health problems in our care homes? Thank you.
Cabinet Secretary.
Grateful to Alison Johnson for that. It's a really important question, and part of the work that our clinical and professional advisory group is working on right now is what more we need to do to introduce increased rehabilitation services and increased support for dementia in our care homes, and how we will most effectively deliver that. My colleague, Ms Hockey, sitting beside me here, is leading on our work in dementia overall, but with a particular focus on what we might need to do, not only in care homes, but actually care at home, where people may have been isolated from their families because of the lockdown restrictions and so on. So we're giving careful thought to that, and once we have a clear plan about what additional work needs to be done, then I'll make sure that the member is aware of that.
Alec Cole-Hamilton, followed by Gillian Martin.
Thank you, Presiding Officer. And can I add my voice to those calls for the commencement of an immediate public inquiry? It is very troubling to learn that in the testing surge that went with the return to school, care homes were forced to play second fiddle to 17,000 children who had the sniffles, who were probably fine. They had to operate in the blind for several days while they waited for delayed test results and kits to come back. Cabinet Secretary, the human tragedy of this pandemic is unquestionably in our care homes. So what assurance can the Cabinet Secretary give that should there be another spike in demand for testing, that care homes will be protected, that their results and test kits turned around in short order?
Cabinet Secretary.
So that is part of the work that I set out in the statement. We have daily contact with the Department of Health and Social Care. The delays were caused in the Lighthouse Lab network, so that's 3 laboratories across the UK that experienced that particular surge. Actually, the Glasgow Lighthouse Lab is further advanced in terms of the number of tests that it can process and the speed with which it does that, but it is part of a UK-wide network, so it has to play its role in handling that overall. Part of the work that we're now involved with, continue to be involved with colleagues in Department of Health and Social Care, is ensuring that we can access the level of tests that we need in Scotland, that we control the mobile testing units and the regional testing centres, and now the walk-through testing centres that are being introduced. The first opened in St Andrews on Monday, that we can control the level of slots that are there so that they don't close down unnecessarily. as well as the work that we are trying to increase in pace, which is the 3 regional hubs that we had always in our plans to introduce from October, to bring that forward where we can. And today I agreed additional expenditure for the equipment for that and for our own NHS and partner nodes, so that we build more resilience sooner in our NHS capacity. But I don't believe that our care homes played second fiddle. It is a really difficult balance. The labs take the tests as they come in and they process them as they come in. They don't make any kind of decision about where did that come from, or is it an old person or a young person. That's not how that works. And we don't want to discourage parents from having their child tested, but help them understand what are the symptoms of COVID, as opposed to what might be a common or garden bug that children get inevitably whenever schools open up again, especially after such a long time. And that's why National Clinical Director sent that letter out, which I think all parents have now received, in fact, from their schools to help with that. The number of care homes, though, that were tested, the number of care home staff that were tested in the week up to the 20th of August was 36,986. So it didn't dip. And my understanding of the numbers that will be published this week is that there has been a dip, but it is very small. So it's not fair to categorise this as care home tests coming in very late. And some of the detailed reporting that I have seen, I have looked at it really carefully, and it has not been, no disrespect to the journalists concerned, they worked with the information they were given, but it is not entirely accurate. And I'm very happy to put the accurate picture on the record for the journalists, or indeed any of those who have a concern.
Thank you. For understandable reasons, I've let the front benchers have longer questions and longer answers, but I now have 15 minutes and 10 people wanting to ask questions. So I'm going to be very firm. I want questions. Gillian Martin, followed by Brian Whittle, please.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary if there's been any assessment carried out on infection control practices between privately run care homes in comparison to local authority-run care homes to ensure that going forward best practice is being shared across the board?
Cabinet Secretary.
So the Care Inspectorate has, in the course of its job, been collecting a range of data across a number of areas. One of the early indications that they have brought back on that is about the different sizes of care homes and different layouts. But at this stage, it is too early to be definitive about both infection prevention and control measures, size of care homes, layout, and indeed which part of the sector they are in. What is clear, though, is that many of those care homes that have gone through the entire pandemic so far without any COVID cases have been small, single-standing care homes, and they are to be commended on the work that they have so successfully done.
Brian Whittle, followed by Richard Lyle.
Thank you, Deputy Presiding Officer. Before COVID-19 took hold in Scotland, with the devastating impact that we've witnessed on our most vulnerable in our care homes, the evidence was there from across Europe that if the virus got into a care home, it could have horrendous consequences for residents with an R number of greater than 10. So, surely, Cabinet Secretary, it was not out with the wit of the Scottish Government to have recognised this, acted upon this information to ensure the most vulnerable in our society were protected, and she's now recognised that better decisions could and should have been made.
Cabinet Secretary.
Well, what I've recognised, Mr Whittle, is that if I knew then what I know now, yes, there would have been different decisions made. But I didn't know that then, and indeed neither did this Parliament when it heard statements from me about delayed discharge, or the committee when it accepted the additional powers for local authorities. Nobody queried any of that. Nobody challenged it or questioned it. So all of us, including you, Mr Whittle, have been on a bit of a learning journey throughout this. And what I won't accept is that somehow this government willfully ignored compelling evidence and chose to do something different. Absolutely nothing could be further from the case. Hindsight is a marvellous thing. Hindsight is a marvellous thing, Mr Whittle, and so is being in opposition. But let me remind you that the challenges this government faced are exactly the same challenges confronting now exactly the same issues as every single government across the 4 nations of the United Kingdom. And we are learning together and working together. Being able to do that across this chamber would be a bit of a step forward.
Richard Lyle, followed by Anna Sarwar.
Thank you, Presiding Officer. My brother was in Highgate Care Home, first care home to have COVID-19. Sadly, he died, not from COVID-19. I personally thank the Cabinet Secretary for her work, commitment in this statement. Can I ask, therefore, if she will report back to Parliament when the recommendations from the review have been published, and will that review set out the next steps, how we can create lasting improvements for the quality of care being provided in our care homes for all our loved ones?
Cabinet Secretary.
Can I thank Mr Lyle, and can I, for the record, I've done it personally, but give him my personal condolences on the loss of a much-loved brother. Yes, I will. I think I want to say 2 things. One, I will make sure that members know what the work plan is for that review and how they are going to go about their work and how they're going to reach out and hear a lot of opinions and views from everyone who's got an interest in this. And I will come back when they have published their recommendations and give this government's initial response to those. In the meantime, though, we will continue working with Scottish Care, with COSLA, with our trade union partners and with others to identify improvements that we can make now in terms of the work with the care sector, both care at home and care homes, in order to ensure that we are learning the lessons and applying them, particularly as we plan for a potential increase, which I hope doesn't happen, but a potential increase in the number of cases as we enter autumn and winter.
Anna Sarwar, followed by Ruth Maguire.
Thank you, Deputy Presiding Officer. Cabinet Secretary, I recognise the need to increase bed capacity and to reduce delayed discharge. But that does not mean sending positive COVID patients into care homes. Can the Cabinet Secretary confirm when she knew that COVID positive patients were being sent into care homes? And does she accept that that act has helped contribute to 2,000 of our fellow citizens losing their lives in a care home setting?
Cabinet Secretary.
So, Mr Sarwar, I've already answered that question. And in terms of whether I accept that those individuals who may have gone from hospital into residential care were COVID positive and the impact that had, what I have done in commissioning Public Health Scotland to undertake the detailed work on the data so that it is validated and we have that analysis, and that will be at the end of this month, and we will come back, I am sure, and look at that in detail. That will tell me and tell this chamber whether or not COVID-infected patients who were still infectious transferred into care homes and what the impact then was in those care homes. We will know that then, but we'll know that then on the basis of validated data from across all of our health services in Scotland.
Ruth Maguire, followed by Adam Tompkins.
Presiding Officer, I understand Scottish Government caution around the resumption of care home visiting, but I also keenly feel the concern of family members about the impact of loneliness and isolation on their loved one's health. Can I ask the Cabinet Secretary what criteria individual care homes will have to meet to allow them to increase the number of people who can visit a resident going forward, please? Cabinet Secretary.
So there are 2 critical criteria for a care home to be able to introduce any kind of visiting. First is that they need to be COVID-free for 28 days, and the second is that they need to be fully participating in the care home worker testing programme, and not all are at this point, although that number is increasing. Thereafter, they need to have produced a plan that the local director of public health or his or her nominee signs off in terms of proper infection prevention and control. That includes ensuring that there are adequate supplies of PPE, and of course we have a role in helping with that, that the staffing rota is of a sufficient size in order to ensure that staff are there to assist residents and visitors, and the new safety huddle tool, which members will recall has been published, will greatly assist care homes in being able to work out exactly what their staffing rota needs to be in those instances. Those are the primary areas of concern. That is also, though, when the Director of Public Health, and the reason it's the Director of Public Health is because they understand the prevalence of the virus in that local area. And so from time to time, as they did in Aberdeen and in Tayside, they restrict visiting beyond what is possible elsewhere in the country in order to provide additional protection whilst an outbreak is being managed and controlled.
Adam Tompkins, followed by George Adam.
Thank you, Presiding Officer. The Cabinet Secretary talked about the vital importance when tests for COVID are taken of getting results quickly. Delay beyond 48 hours must be minimised, she said, and we are working with our UK colleagues to improve this. So can I ask, what steps precisely is she taking to ensure that such delays are minimised, and how is she working with her UK colleagues to improve this situation?
Cabinet Secretary.
Thanks very much. To Mr Tompkins, it's important to say that in terms of our NHS processed tests, they remain over 95% under 24 hours in terms of the total turnaround time. The problem that we have encountered with the Lighthouse Lab is precisely that problem of it being part of a 3-lab UK network. So when there is a surge in one area, all 3 labs have to respond. And not all 3 labs at this point are at the same level of processing capacity. The Glasgow one is ahead. So the work that we undertake is that on a daily basis, my senior officials are talking with their counterparts in the Department of Health and Social Care, anticipating what the demand is likely to be from one day to the next, how they can flex the processing capacity to do that, and as I said, introducing now from Monday direct control here in Scotland for us on the availability of testing slots, sampling slots in the regional testing centres, the mobile testing units, and now in the walk-through centres. In addition, we had already planned to increase our NHS capacity. That was always part of the plan, to introduce 3 regional hubs as well as the existing NHS labs. The first of those to come on stream from October. We're working now to see if we can bring that forward in order to increase that capacity, as well as standing up now many of the academic nodes that we had contracted with and now need to get them standing up so that we increase the capacity that we have, if you like, at our own hand through the NHS and through these other measures. That will include discussions that are now underway with 2 of the private labs in Scotland.
George Adam, followed by Neil Findlay. Mr Adam.
Thank you, Presiding Officer. Can the Cabinet Secretary inform us if the UK Government has advised of their intention to undertake a similar independent review of adult care sector in England, and if they have indicated that they are commissioning any analysis of hospital discharges to care homes?
Cabinet Secretary.
So on the latter, I have written to all of my colleagues in so Matt Hancock, Vaughan Gethin in Wales, the Health Minister in Wales, and Robin Swan, Health Minister in Northern Ireland, advising them of the work that I have commissioned from Public Health Scotland with respect to discharges from hospital, asking them if they wish to do similar. I've not yet had a response from any of them. On the independent review of adult social care, I'm not aware that any of the governments in the UK intend to follow what we are doing. But of course, if they are, we're very happy to cooperate with them in that regard.
Neil Findlay, followed by Joan McAlpine.
During this crisis, we've seen older people discharged untested, discharged COVID positive, pressured into DNR notices, not admitted to hospital for care and not assessed before going into care homes. And what has been the response from the Minister for Older People during this process? Absolutely nothing. And today she spends her time during this important statement in the tea room blethering to her pals. What is the point? What is the
Let me hear the question, please. Let me hear the question. Dr. Allen, I want to hear the question.
What is the point of having a Minister for Older People when during the biggest crisis affecting older people in decades, she is posted missing?
Cabinet Secretary.
Well, I'm not posted missing, Mr Finlay, and neither is Ms McKelvey. If you understood the way government works, I appreciate it's not something you've experienced, but if you understood how government works, you will know that Ms McKelvey and I and other colleagues in Cabinet are constantly in touch with each other, hearing what we are doing and how we can contribute. And Ms McKelvey has contributed a great deal to our understanding and thinking, particularly from the perspective of older people, and undoubtedly will do to the independent review. But if that is the sum total of the question that you can ask when we are debating something as important as care homes, then the next time, Mr Finlay, that you try to pretend that you care deeply about this issue, I'm afraid your credibility will be pretty weak.
I sincerely, Mr Finlay, I hear, don't, excuse me, don't speak over me. I hope it's a point of order. Let's hear what your point of order is first.
Presiding Officer, the Cabinet Secretary may know that my mum is in a care home and I will see her for the first time in 6 months on Friday. I take great offence to that.
Can I say, Mr Finlay, I've huge sympathy for your personal circumstances, but it's not a point of order. I now call Joan McAlpine to be followed by Sarah Boyack.
Thank you, Presiding Officer. I welcome the routine testing of asymptomatic care home workers and the recent figure of more than 36,000 shared with the Cabinet Secretary today. Has the Government been able to assess how effective this specific measure has been in stopping the spread of the virus? I understand it's early days, but if that hasn't been done, are there plans to do this?
Cabinet Secretary, please.
It's a very important point, and there are figures. I don't have them to hand, but I'm very happy to make sure that Ms McAlpine has them, which shows, as we test care home workers, the numbers of positive tests that come from any care home, whether it is a care home worker or a resident. And although those numbers are declining hugely, the balance is in terms of care home workers. And I know that very many of them appreciate the fact that there is now that testing because they care very much about protecting the residents that they look after.
And finally, Sarah Boyack, please.
Thank you, Presiding Officer. Cabinet Secretary, while we await the conclusions of the care review, can you commit today to ending insecure care work, increasing pay for staff and abolishing the registration fees low-paid staff currently have to pay to be able to work in the care sector?
Cabinet Secretary.
So Ms Boyack knows full well that the care sector is delivered by a mix of private, public and independent. Each of those have their own terms and conditions. Too few of them, in my opinion, negotiate those properly with trade union representation. It is not in my powers to interfere directly in that, but it is in my capacity to try and ensure that the fair living wage is paid and to put resource in place to try and ensure that that happens. And that is what I have done. But I fully expect the independent review, as it looks at not only how adult social care should be designed with the individual in mind, how it could be best delivered, how it could best be regulated to ensure consistency of quality and standards, but also how it should be funded. I fully expect that independent review to have quite a lot to say about the terms and conditions that should be awarded to those who work in that sector, because the work they do is so valued. In the meantime, I will continue to have discussions with both COSLA and Scottish Care on the national contract and the commissioning measures that they can put in place in order to try and deliver better across the whole sector on the fair work principles, which, as you know, this government has signed up to.
Thank you. Thank the Cabinet Secretary. Can I thank members for the cooperation, as all members got their questions, and that's what we always want to happen. Thank you. There will be a short pause while we move on to the next item of business.